my name is Natalie. I'm going to be your student nurse today. I'm going to first start by, I did my hand hygiene. I closed the curtain for your privacy, and I'm going to verify your first and last name and date of birth as soon as I get these gloves on. All right, Mr. Smith, can you verify your first and last name and date of birth? Thank you so much. So doctor ordered some trach care. Basically, I'm going to be cleaning the trach area and suctioning out any secretions, as well as changing the gauze that's supposed to be there, and just making sure that you're all clean and comfortable. If at any point in time you can't breathe for any reason, just let me know by raising your arm straight up in the air. That'll be my indication that you need me to stop. I've raised the bed to a working height. I'm going to lower this railing as well. I've made sure that my oxygen is on 15 liters, as well as that my ambu bag is connected to the oxygen, or my supplements oxygen. And then my suction will not exceed 150, and I'm going to verify that that is working. I'm going to go ahead and auscultate your lungs. I'm just going to take a listen in front and back.
Yeah, you can either just.
I'm not gonna say anything. But
Yeah.
Okay, I listened anteriorly. I would listen posteriorly as well. Everything's good. I would also double check with an O2 saturation monitor. So now that that is finished, I'm gonna go ahead and lay this chuck on you, just so we don't make a mess. All right, Mr. Smith. We're gonna go ahead and get started. I'm moving my gloves. I have hand hygiene. I'm going to open this up carefully. With my saline, I would make sure that if it was open, I would spill a little bit out and then pour it in here, but since it's brand new, I'm going to go ahead and put on my mask and then my goggles, but this is a shield in one.
Will you have your face shield? You don't need it. Oh wow.
Alright, hello.
So now I'm going to go ahead and put on my sterile gloves. I'm going to set this down because it's in my way. All right.
Okay. Go ahead, whatever. Do you have your questions together? Yep.
Yeah.
Alright.
3, 2, 1, go. Hello, Mrs. Smith. I am your student nurse, Mackenzie, and the reason I am here today is that we are going to be performing trach care. We're going to be suctioning everything that you have in there to make sure there's no
I'm going to remove the catheter, and with my dominant hand, since both my hands are still clean, my dominant hand is my left hand. I'm going to go ahead and coil this in my dominant hand, and then I can get rid of this. Boom. All right. So this will be my non-dominant hand. I'm going to remove the oxygen, and with my ambu bag, I'm going to hyperventilate the patient with 3 breaths. Dip this in, making sure that it's working, but I'm not going to push it going in. So I'm going to enter it in there until it says, and then removing it, I'm going to swirl as well as suction. All right. that back in here. 3 breaths for the patient. Waiting 30 seconds to a minute in between. Once again, I'm going to insert, and then upon removal, I'm swirling and suctioning as well. And then if I had to, I would repeat the step a 3rd time, but not to exceed 3. I'm going to place my oxygen back on. And I'm going to coil this. Remove it. Okay. The suction is off. At this time, I would also remove the old gauze, but there is no gauze on this patient currently. And then replace my oxygen, and then I'd put the old gauze in here, wrap this up, and then I would toss hand hygiene. I would perform oral care on the patient. I am ensuring that I would get another pair of gloves, but I would ensure that my patient's oxygen saturation is okay. And then I will auscultate one more time. Just to make sure. Well, I'd remove this as well.
Now I am going to open this wafer.
This way, anterior and posteriorly, and measure the pulse ox. And then I can remove my mask. Now moving on to trach care. I'm going to leave this on. I loosened it. Let me tie it back up. Now that I've suctioned the patient, I can move on to trach care. All right, Mr. Smith. Let me just call another nurse if she could bring me another pair of gloves really quick. Sorry. I'm going to perform hand hygiene, and then we're going to replace that trach piece there. Thank you so much. All right, she brought me some gloves. I have my supplies here. So at this time, place this back underneath you. I have not left the room. If I did leave the room, obviously the bed would be in lowest position, wheels would be locked, everything would be in place. I would also re-verify the patient and make sure that I adjusted for privacy if I had to re-walk into the room and explain the procedure, but I did not leave. So now I'm going to carefully open. I have my replacement inner cannula here. I'm going to start by removing the old one. Placing oxygen. Since we're replacing it and I have a new one, I'm gonna discard of that. Carefully opening up. I'm going to pour a little bit of this inside of the tray.
Wait, what was so funny?
So now I'm going to pull out my sterile gloves.
No. Twice. I was laughing the difficulty with the mask, but I held it in. I don't know what happened. Oh, but I was gonna tell you. When you get this part, you have to remember that it has to be for you. What? The section has to be for you in your I know, but I'm saying when you wear it for you.
Like in my non-dominant.
Yes.
Yeah.
So sorry. Oh, it's okay.
Minus 5.2x.
I held it.
I was like,
So
no, and
since
then
the
my
inner part of this is sterile, I would drop this.
And then my glove were,
Yes.
we're gonna pretend like it didn't.
And then I'm going to
I was holding it. You're gonna see me shaking on here. I was holding my lap in so well. Oh my gosh.
First of all, I'm trying to hide my whole face, so hopefully you wouldn't
Was like the
see.
beginning good with everything?
Yeah, it was on. That's when I was like, I'm not ruining this for her.
Oh,
And then I just-
good.
Shiny side would be down.
Take anything seriously, so yes.
You guys laugh out loud.
And then I would take my 3 gauze pieces, put it in there. I have an extra
I know. And I'm like sweating.
tie. I have my new
If I'm doing
cut
good, you
gauze.
better not laugh, 'cause I can't do it again.
And then some more gauze if necessary. And then I would
Your fault.
drop that into the saline as well. Okay, so I'm going to start by cleaning. My right hand is now no longer sterile. Cleaning underneath.
You can't laugh. Then it's like, whoa, now I can't stop laughing.
No, she laughed and then it just.
Cleaning underneath.
Okay, let's try.
One more. Cleaning. Dropping. So now I'm going to replace the cannulas, having it twisted.
Perfect. I feel your pain, except.
This is the wrong size, so let me just grab it. In real life, I would not do this. I would have the correct size, but
Yeah, once and it was like me to
they twist it and then turn it to where it clicks in. So then now
That has to go to the suction, so it shouldn't be.
It's not. Should be like.
I'm going to loosen the straps, but holding this in place.
So is this, see, this is what we should start. So, when you dip it in the saline,
I would take my new strap,
wrap your hand with it.
put it underneath the patient's neck, and then secure it on one side. We'll pretend like this is a new one. I've secured it on one side while still holding this in place. And then I'm going to take my gauze and then inserting this underneath this piece. My hands are no longer sterile.
So what if I take it, open it, take it, carefully pull?
Then I would tighten this on the other side. And then after I'm finished with that, I would replace my gloves, hand hygiene, verify and auscultate the lungs to make sure that the patient's breathing okay. And I would also double check with the O2 saturation, the monitor, the pulse ox. And then if there's anything else I can do for you, Mr. Smith, please let me know. I would lower the bed to the lowest position, lock the wheels, call lights in place, and just ensure cleaning up behind myself. If there's anything I can do for you, please let me know. I'm gonna remove my gloves and hand hygiene before I leave. Thank you so much. Have a great day.